Hello and welcome. Across the globe, the shortage of medical practitioners, especially specialists, remains a pressing challenge. Specialists are vital to advancing healthcare, yet data reveals an alarming deficit in many African countries. The ratio of specialists to patient is critically low. Even within the pool of specialists, certain fields tend to attract more attention than others. Laboratory medicine is another specialist area which frequently is underserved and underrepresented. Even within this critical area, subspecializations such as chemical pathology, despite its pivotal role in diagnostics and patient care, often find itself unpopular and overlooked. And yet, the demand for chemical pathology services is growing steadily, especially as the disease become more complex, requiring more advanced diagnostic techniques. This story of disparity is one that resonates across Ghana, across Kenya, and Nigeria. And that's where this project steps in. On the 1st of February 2024, a remarkable initiative was launched in partnership with the National Postgraduate Medical College, the Ghana College of Physicians and Surgeons, the Aga Khan University in Kenya, the Royal College of Pathologists, and the Association for Laboratory Medicine. Now, over the last 12 months, the focus has been on improving the quality of training in chemical pathology and enhance service provision in these countries. This groundbreaking work was made possible by the Global Health Workforce Programme, funded by the Department of Health and Social Care UK and directed by THET, the Tropical Health Education Trust. But why this project in the first place? In Ghana, the pipeline of trainees in chemical pathology to fellowship level is shrinking, with fewer trainees entering the program. In Kenya as well, in spite of the work done by COPEXA to lay down the groundwork for specialist training, there is still no established fellowship training for chemical pathology program. To address these gaps, the project has created new training opportunities, equipping local faculty and trainers to sustain training efforts and enhance the performance of health workforce. By leveraging on the unique strengths of Ghana, Kenya, and Nigeria, this project has successfully delivered on its objectives, setting the stage for a brighter future in chemical pathology. Let's now hear from the team at the Royal College of Pathologists, other members of the Health Partnership, and the participants who attended many of the training events.
My name's Kelly Price. I'm the International Projects Officer for the Royal College of Pathologists in the UK. Over the last 12 months, I've had the privilege of leading the work of the Global Health Workforce Project. We've done this in collaboration with partners in the UK, in Sub-Saharan Africa, and with the support of THET. It hasn't come without its challenges. There's been so many mountains to climb, but I can honestly say we can be very proud of what we've achieved in a very short space of time. With focus, determination, and perseverance, we have hit milestone after milestone, and we can honestly be very proud of what we've achieved. So I just want to take this opportunity to thank everybody for everything that they've contributed to the project and for participating.
I am Roxanne. I'm the Global Health Project Officer on the Global Health Workforce Project. So I am the face behind all the emails that everyone has been receiving from the international team along with Kelly. So we have had a really successful project. We've been able to provide 9 monthly case report sessions and 4 quarterly webinars, and also a day for already qualified chemical pathologists. And we had a great turnout for all of those events. We've been able to deliver a 12-week online CPD certified course, which is for point of care testing in Kenya. So that was amazing and great turnouts as well, and a great success. We've been able to undertake 2 scoping visits, one in Ghana to make recommendations and also one in Kenya to make recommendations. We've also been able to review the key chemical pathology curricula with a view of looking to harmonise standards for the chemical pathology fellowship training. We've also been able to provide mentoring for 2 chemical pathologists in Ghana. So we have been able to achieve all of our deliverables.
So the RCPAT TED-funded project, one of the components that was included was a scoping visit to the Aga Khan University Hospital Department of Pathology to assess our readiness to host a chemical pathology fellowship program, but also to develop a curriculum that is of international standards for a chemical pathology fellowship program. So we had Professor Akande representing the West African College of Pathologists, who visited with us and spent time in the laboratory, spent time with the chemical pathologists, the 2 chemical pathologists we have on board, to develop this curriculum. And what it has done, it has provided not just the impetus to establish this fellowship program in the institution and within the department, but it has also created a visibility for the profession. Most people and other specialists and physicians really don't even know that there is something, are not even aware perhaps that chemical pathology exists as a specialty. So I think that's one of the good things that has come out of this project, and we look forward to now establishing a fellowship within the institution because it is an area that is sadly lacking in terms of skilled manpower.
The 12-week POCT online pilot has been very exciting, both for faculty and for the participants, all the way from the designing and the implementation of the point-of-care testing. The impact of this point-of-care testing pilot has been that 8 pathologists, clinical pathologists from across the country were trained in POCT administration and operations, and these will assist these pathologists in implementing these point-of-care testing programs in their sites. It will also help with accreditation of these POCT programs, knowing that Aga Khan University, where the pathologists were trained, is accredited. So we expect to see better and improved point-of-care testing programs across the 8 sites where the pathologists were trained. We are also happy that the Ministry of Health, through the public health laboratories, were able to join us during the in-person training. We had discussions with them on how we can move point-of-care testing programs across in the public health sector as well as the private health sector.
Esteemed partners and dear participants, words cannot express my heartfelt happiness for the opportunity to be part of this great project, which shares my vision and mission on professional capacity building through mentoring. Having been part of the design and implementation of this project over the last 12 months, I have committed all humanly possible resources to the successful outcome of the deliverables across the 3 countries of Nigeria, Ghana, and Kenya. The most exciting of these deliverables, which I want to dwell on, are scoping visits to Ghana and Kenya, online monitoring of residents in Kolibu Teaching Hospital, Accra, Ghana, as well as development of fellowship curriculum with partners in Aga Khan University, Kenya. The scoping visits were unique in the sense of environmental scanning, facility assessment, capacity building, physical mentoring, and most importantly, meeting old and new friends in exchange of ideas and future collaboration. My immense gratitude goes to the staff and management of Kolibu Teaching Hospital, Accra, Ghana, for the wonderful reception accorded me while I was there. I also want to pay a very good tribute and gratitude to the registrar of the Ghana Postgraduate Medical College. of physician and surgeon for the warm reception and fruitful discussion bordering on the sustainability plan post the project. I'm also delighted to inform that I met with Mr. Matthias of the Tech's office in Ghana, and it was very wonderful, and for contributing to a memorable visit to Ghana. Special appreciation to Angela, Dr. Daniels, Amuse, and Dr. Shireen in Kenya for their wonderful reception and the gifts presented to me during my visit to Kenya. My sincere appreciation goes to the Provost of the College of Medicine too. The online mentoring has afforded me the opportunity to work with two great energetic young Ghanaians who have built a relationship beyond official to personal level. And the mentoring has provided us the opportunity to be friends, respect for one another, and the good outcomes that we have achieved in the development of a proposal for their future dissertation. The curriculum review afforded me my physical presence and my contribution over 2 days. Dr. Daniel and Dr. Godfrey were very, very wonderful, and I appreciate my working with you. I must pay great tribute to their personality, their dedication, commitment, and the passion towards the takeoff of the program. Overall, it has been a successful outing, and I'm most delighted to report that all the project deliverables were achieved. This wouldn't have been possible without the effort and commitment of our partnership. Therefore, from the bottom of my heart, I wish to say thank you to the Departments of Health and Healthcare and Social Services of the UK, Tech's Projects Management, the RCP team, ably led by Joe Binklow, assisted by Kelly and Roxanne, and other background staff, especially the IT and the Finance Department. I also recognize and appreciate the effort of the Laboratory Medicine Association of the UK, the Sub-Saharan Africa and the Nigerian representative of the WAs of RCP, Dr. Kenny Regu and Professor Bafunwa. And I also appreciate the Registrar, Chairman, Secretary, Faculty of Pathology of the National Bureau Medical College of Nigeria, the Registrar, Ghana College of Physicians and Surgeons, management and colleagues at Kolebu Teaching Hospital. My appreciation goes to the Provost College of Medicine, Aga Khan University, Kenya, the Dean Postgraduate School of the same university, colleagues, and special mention of Angela, who made my travel and stay in Kenya seamless. Finally, to all their participants, I have learned so much from you, especially the courage to carry on our self-development journey of 1 year. As for every living thing and project, there must be a time to say goodbye, and the time is now, even though it's hard to say, but my goodbye is with a big thank you to all.
My name is Elikem Kumaho. I'm a chemical pathology resident at the Kolebu Teaching Hospital in Ghana. I was fortunate to participate in this training project organized by the Global Health Workforce. These monthly meetings were a very valuable part of my professional growth. They were well organized, allowing for in-depth exploration of interesting and challenging clinical cases. The experienced doctors and experts who led these discussions shared a wealth of knowledge and passion, making each session an enriching experience. The topics and cases were thoroughly researched, providing us with the most up-to-date information and practical advice we could apply in everyday work. The interactive nature of these sessions was a key feature. The discussions after each presentation encouraged a lively exchange of ideas, fostering a collaborative learning environment. A particular highlight was the visit from Prof. Akandi, which provided much-needed encouragement and direction for our training. I would like to thank all senior faculty, organizers, and funding agencies for this wonderful opportunity. Thank you.
As we bring this journey this incredible journey to a close, I would like to take a few moments to reflect on the achievement and extend my deepest gratitude to everyone involved. First, a heartfelt thank you to Catherine Hayden, the president of the Association of Laboratory Medicine, Dr. Kenneth Irebu, representing the National Postgraduate Medical College, Victoria Logan, the Chief Executive of Association of Laboratory Medicine, Professor John Obafuwa, Dr. Solomon Kaysen, representing the Ghana College of Physicians and Surgeons, Dr. Shaheen Saeed and Dr. Daniel Maina, both representing the Aga Khan University in Kenya, Professor Akonde, a senior chemical pathologist from Nigeria, and Professor Wiredu. A big thank you also goes to the faculty who supported the project's learning opportunities and many participants who contributed their time and expertise. Finally, this project wouldn't have been possible without the guidance and funding from PHET and the Department of Health and Social Care UK. To all involved, your dedication has left a lasting legacy that will continue to shape chemical pathology training and service provision across these countries. We will now leave you with some key data showcasing more of the project's achievement. Thank you once again.